One excellent design for an experiment is a randomized comparative experiment. So here, when the goal in designing an experiment is to ensure that you can detect whether those explanatory variables actually cause changes in the response variables, then you would want to use one of these randomized comparative experiments. So this confounding that we talked about can often prevent experiments with just one treatment from that particular goal. So what we want to do if we want to compare two or more treatments, we're able to eliminate the influence of a confounding variable by randomly assigning the treatments to the subjects. What's going to happen by doing that is that we're going to create groups that all are influenced by that confounding variable that we've randomly assigned our subjects to it. And then whatever results that we see, we know the confounding variable affected both groups. And so any distinguishable difference between the two or more groups can be considered from the treatment and not from this potential confounding variable. So keep in mind what's happening here is the confounding variables are impacting all subjects equally. So any differences that you see in the response receiving different treatments can actually be attributed to the treatments. So the way that we would set up a comparative experiment is that we would always start with random assignment. So in this study, looking at sickle cell anemia, which is a disease that can cause severe pain and many complications, there was a study done to determine the effectiveness of this drug, hydroxyurea, and they recruited 299 adult patients who had had at least 3 episodes of pain from sickle cell anemia. So we made sure that we had people who were actually feeling pain, and we wanted to see if this drug could improve. So we start by randomly assigning a number of patients to the different groups. Typically, this is going to be a relatively similar number, but not always. Sometimes we can only include so many people in each treatment group, and so the numbers might not always be exactly the same, but most of the time you will see similar numbers in the different groups. It could be 2 groups, it could be 10 groups, however many treatment that you want to include in the study. So once you have identified how many are in group 1 and how many are in group 2, you then indicate which treatment the 2 groups had. One will receive the actual drug, one will receive the placebo. If you were studying different levels of different levels of the same drug or different drugs, then you might have more than 2 treatment groups. But then what makes this a comparative study is that at the end, you compare whatever it is that you are trying to influence. So in this case, we would compare the pain episodes. Now, I do want to make a note that the placebo here sometimes is not going to be a placebo. Sometimes it's going to be the control. There are certain situations where we ethically have to give some sort of treatment. So for example, if you were trying to study some of the drugs that are being used for something like diabetes, you cannot withhold treatment for people in the control group. So you would have to continue giving them the treatment that is what they were already using, whatever the standard care would be for that particular group. So your control group you can also think of as the status quo group. They're just getting what they've always gotten. So in the case of a life-threatening illness, then you would want to make sure that you were at least providing some level of standard care to the placebo or the control group, and then you would change to a different treatment for the other group. So just keep in mind that ethically, we would never withhold treatment from somebody who needed it. In your homework, you will be describing these randomized comparative experiments using a figure like you saw on the last slide. So in a simplest randomized comparative experiment, you're just looking at 2 treatments. And make sure that you include the essential information that you started with random assignment, that you had 1 group for each treatment. You say the number of subjects in each group, what treatment each group receives, and that the response variable is being compared at the end. As a reminder, the placebo group is being used as this control group because you want to make sure that any lurking variables are accounted for. Keep in mind that humans sometimes respond favorably just because they're getting treatment. When we deal with experimental design, we want to make sure that we recognize some very important principles. So in experimental design, it's essential that you use randomization. Randomization will ensure that your groups should be similar on average in all respects before that treatment is applied. Now, it's not a perfect method, but it's certainly the best that we can come up with. So by randomly assigning the subjects to the different treatment groups, you're going to ensure that you have these similar groups before you start looking for the effects of the treatment. Your comparative design is exposing all of your groups to similar conditions. So the only thing that's going to be different between the 2 groups is the actual treatment that they receive. And this way, any additional lurking variable that could be happening would be affecting all groups equally. And so you should only see differences from the treatments and your differences between the 2 groups. So there's 3 principles of experimental design, and you absolutely need to know these 3. You need to know that you have to control for the effects of lurking variables. Most of the time that's done by at least comparing 2 or more treatments. You need to randomize. You need to use impersonal chance to assign the subjects to the treatments, and you need to use enough subjects so that you reduce the chance variation in the results. If you only have 5 individuals in each treatment group, then you might just have 5 people who respond differently than the rest of the population. But if you're looking at a study with 100 or 1,000 individuals in each group, then the chance variation is not going to be as frequent, and so you're going to get a better idea of what the average or typical value is doing. The variations kind of spread out among all of those people, and you see a much better picture of what's actually going on with the treatment.